Welcome to Sit and Stay, the podcast that breaks down the challenges of starting and maintaining a mental health practice into digestible chapters. Sit and Stay is presented by RipsyTech, an electronic health record company committed to addressing the mental health crisis in the United States.
Hello, everyone, and welcome back to the Sit and Stay podcast brought to you by RipsyTech. I am one of your hosts, RipsyTech founder and CEO, Tom Tarshis, and as always, I am joined by our creative talent director and product manager, the amazing Parker Anderson. Hey, Parker.
Wow. Hey, Tom. Wow. Thank you for that brilliant intro. It sounds very interesting hearing somebody else say the intro out loud. I feel weird about that. It makes me want to rephrase it even, just hearing somebody else say it.
Well, and this is our 30th episode of our podcast, and so
That's true.
Felt a little fitting to maybe mix up the intro, and I'd always been wanting to give it a shot. And as you mentioned to me, Parker, we've now surpassed one of our former competitors whose company no longer exists, but the previously well-regarded EHR company Luminello, which was acquired by Simple Practice. They had filmed 29 episodes in about a year and a half, I believe, and this will be episode number 30 that we are doing in 30 weeks.
30 weeks.
Yeah.
Yeah. An episode every week. Yeah, that's, I think we may have mentioned this in the first episode that we ever recorded, that I kind of started with my own separate podcast, just about my own hobbies before we decided to do this for RipsyTech. And I was telling you earlier, I'm not sure I was ever as consistent as this with my own podcast. I mean, I try to do it once a week, but I think for us to be doing episode 30 already, it feels like we just had the idea to do a podcast. So it's pretty wild to be saying, oh yeah, this is the 30th one. Wow.
Yeah.
it's very cool.
And the other interesting thing about it is it feels like we haven't even scratched the surface of all these, well, I can say available topics, or asterisk all of the ridiculous information I've learned over the past 18 years. But either way, they're fun to do lots of times. I'm really excited about what we're going to talk a little bit about today. And this is a kind of a topic that is a little more subjective, and so is a little more,
right.
I'll try to be, people will see what my opinions are on the subject, but we'll try to be open to other ways of doing things. But I definitely like this topic today a lot.
Well, let's not keep the people waiting, and let's dive into it. I would say, I'll be very interested in picking your brain on this topic. So today we want to talk about how much to write in a visit note for a mental health provider. There's, I believe, there's been one way of doing things, and then things have evolved, and now I think we're going through yet another evolution with AI right now. So I think there's a lot to unpack. But let's first just kind of talk quickly about, what is a note? Why do providers write notes? What critical information is supposed to be included in these notes? I think that would be the right frame to kind of start from, because that's going to inform, the evolution discussion.
Yeah, and this, we can first start in very general terms about, when medicine started. Whenever you did something with a patient, there was always, not always, of course, but within the last 120, 130 years, there was some documentation that accompanied patient visits. There's some really cool old journals of Lancet, which is this British medical journal that go back to the 1800s, where you can go in and actually see some of these notes or the descriptions of what happened in different doctor visits. But the initial idea around writing notes on a patient was that yeah, if you were their doctor and they came in on a certain day, you want to know what their complaint was and what you did. And so that when they came back, you were able to reference that. And it was a way to make sure we were providing good care for our patients. That is how documentation started and was the point of it. Things have drastically changed along those lines, whereas that is still true, and hopeful that, the main reason we're doing the documentation is that we keep a record of someone's clinical visits, and it helps us do a better job in their treatment. The advent of malpractice and the legal system has complicated the note-taking process, probably more than anything else. And what that means is one of the most common things that happens with visit notes now is that they're used in lawsuits against different clinicians who feel like they've received poor care. And because of that, and because of the fear society we live in, and how a lot of people are trained, a lot of visit notes started to become more, let me write down the really important things so in case I ever get sued, which is definitely not the right way to have to think about things, but that's been one evolution of clinical notes over the years.
Okay, so before we started talking about this, when we were talking about the idea of doing this episode, you mentioned to me that there used to be a difference between, a session note versus a process note. Can you talk a little bit about that separation, and is that still a thing, and how important is or was that?
Yeah, so in the field of psychiatry or psychotherapy, there's a little different asterisk on this whole writing notes after your patient visits. Psychotherapy notes have an extra protection in them, in which and this episode sort of leads into another episode we have planned on the open notes movement and federal law regarding patients having access to their clinical records. But the tradition, even when I was training in psychiatry and for other people doing therapy, was that you could maintain a brief clinical note about what happened in the session. And then if you wanted to have a more in-depth or detailed note for patients in psychoanalysis or in a psychodynamic therapy process, that you could keep these notes separate. They were called process notes because it's not something that was necessarily needed in the medical record, but it was something that was helpful for the treatment of the patient. And then these notes were allowed to be kept separate under lock and key from the patient's medical record. And this had, with the advent of electronic health records and really universal adoption of doing our notes electronically, which still is not 100% true, but
Right.
it has made the situation with process notes, I think it has dropped with the number of providers that are doing process notes, because if you're already typing on a computer, the idea of having extra notes on your patient that you're storing on paper somewhere else doesn't work very well with a standard workflow clinical day.
Okay, so it sounds like, yeah, it's evolved into kind of being just like just do it all at once, keep it all in one place. I guess from a user experience point of view, it makes perfect sense. Reduce the number of clicks as much as possible. Keep it all in one place if it makes sense. So when it comes to actually writing a note, something that I find myself curious about is how do providers strike a balance in the amount of detail that they provide? Is it better to be efficient in your documentation and be I don't know if vague is the right word, but striking a balance between getting something done at an efficient pace versus getting something done that is as detailed as possible? Is there any kind of ethical concern with writing too much or too little?
Yeah, and it's a good question. And Parker, I mentioned the malpractice issue with writing notes and then the general care issue. The other piece that I haven't mentioned yet is that the other thing that the notes are used for is for insurance audits to make sure that you're billing correctly. Now, this doesn't really relate to clinicians that don't accept insurance, and for some of the non-prescribing clinicians, it's all you need to sort of write is their 55-minute therapy session if it's just being billed on time. But for those of us who bill an E&M code on complexity, our note needs to justify that complexity that we're billing. And so it's this other piece where it feels like people people are worried about, does my note justify what I'm billing? They're worried about, does this cover me if something bad happens? And this is a good way to track what's happening with the patients. And I think that we try to put some tools in again to help people choose the right billing code when they're doing the documentation. But more specifically, it's such a complex topic. The other thing that happened recently was there was a big change in what documentation was required to hit different levels of complexity, and this was for all medically trained clinicians, so nurse practitioners, physician assistants, and physicians, that they actually eased up on what you had to document in order to meet different bill codes. And this happened a few years ago and has made things better because even everyone realized that people were documenting just to justify what they billed and less about what was maybe relevant or important in a clinical visit. So to your question of, when we were running a busy clinic with 60, 70 clinicians, we really don't want the documentation piece to be burdensome. And I was really someone who pushed for kind of bullet point general terms to document what happened in the session. So for example, if it's a psychotherapy session, instead of putting a lot of detail about an interaction with a family member that maybe you talked about for 20 minutes in session, I would just bullet point and say discussed conflict with father. And that puts in the note what was discussed. It kind of protects if the patient's going to be looking at the note, which with this open notes law that's passed, patients are going to have access to their medical records. And, again, we'll do another episode on that. But for efficiency also, if you can just bullet point what happened in the different sections, you're going to save yourself a lot of time. It makes for a cleaner read, because the other thing is, if someone transfers care and transfers their medical records, if you write a lot of information on every note, no one else is ever going to read that with the same amount of effort that you typed it in. And it is also true that 99.5% of the time after you write a note, you actually don't look at it again. So can we minimize the time and effort that you're spending on this part of your job, which again is the number one most unpleasant aspect of clinical work, and replace it with efficiency, maintaining the important pieces in your note, but being able to be efficient in the whole process. And that's what goes into sort of the design of RipsyTech on how we try to structure the notes to make that process easy as well.
Yeah, we tend to get a lot of compliments about the note writing experience, which is always, for me as a non-clinician, it's not always easy for me to tell. I look at it and I'm like, yeah, this makes sense. And then when I hear somebody use it and they say, oh, this makes so much more sense than what I'm currently using, I'm like, oh, okay, great. So yeah, I think that's something that we're definitely very proud of. So a couple of weeks ago, we talked about scribe services, and I think AI was it evolved into a discussion about AI and how there are a lot of different programs out there that are essentially trying to solve this problem of, like you said, the documentation and note writing is probably the least favorite part of every clinician's job. So the AI programs out there are trying to solve that problem, speed that process up as much as possible. And when we were talking about recording this episode, you had mentioned that your experience using the AI software, the notes are longer, and I'm assuming that also means like more detailed, or kind of capturing. If you're using a recording of the session and then having the AI write a note for that, I imagine they are capturing, just about every detail that they can acquire from, the just spoken word. So, you kind of mentioned that with that there might be implications to the notes getting longer, and I'm kind of wondering what might the implications of that trend be if it kind of continues on that path.
Yeah, and the nice thing about AI is that the models are trainable, so that theoretically you could work with a AI model to customize. I like very brief notes. Maybe someone else likes a little more detail. AI should be able to learn that and customize that by provider. I will say though that if you've got the AI service taking the burden of actually typing things out yourself, I do feel like I've noticed notes getting longer again from providers that are using the AI service. And it is, I get it that it's not really, it's hopefully saving time in general, but what it is doing is adding 2 or 3 times more information than maybe people were used to putting in the notes. And I'm not necessarily sure that's a great thing to be happening. And in therapy sessions, it's not super helpful to like have a play-by-play of what you talked about. It's more helpful to, summarize, talked about this relationship, practice this cognitive distortion retraining, worked on X, Y, or Z, versus kind of a play-by-play of what's happening in the session or what the patient is telling you about their life. So that's what makes it an interesting topic to discuss and think about, so that when you're not losing time by having to type more yourself, what is going to happen to clinical notes, and are they going to get longer again? And is this the case in other fields of medicine as well? I think it'd be a cool research project to evaluate that.
So, what would you say is your biggest concern with the notes being longer? Is it that things might be captured that maybe the insurance didn't need to know, or the patient doesn't need to read when they go with open notes, and if they read their own, visit note? Like what is the biggest concern with them being longer? I'm just speculating.
Yeah, well, and I think if we go back to why documentation started, which is, to make patient care better and have a quick way to see what's happened previously. The biggest problem with having longer notes that are not summarized efficiently and concisely is that people are less likely to look at them, and that ultimately could hurt patient care.
I see. And then if somebody has the AI write their note for them and they don't review that note, and then that note gets pulled up for some kind of specific court case, and it's like, I don't really remember writing that, that's definitely a problem.
Yeah, and we mentioned that a little bit, and I think there are other. There are always issues here with, um, you know, you need to review what you're signing your name and your valid license to. Although we know that that doesn't happen always properly. Um, and yeah, I think as we mentioned on that AI note episode, I'm very curious to see what happens legally. I haven't heard of anything yet, but with the AI generated medical record notes, given the litigious nature of the country, how is that going to play out?
Right. Right. And I think, yeah, when we discussed that, my comment was, yeah, it sounds like it's only a matter of time. It's not an if, it's a when, and we'll have to sit back and see what happens.
Yeah, and we did a lot of work around, who does a good job with their notes, who can be like a note trainer or supervisor, who can help people write good, concise notes that meet the care requirement, insurance requirement, and if you were to get sued, make sure you include that you asked if a patient is suicidal or not, right? So some of these basics. Right. And so I'm very curious to see how all of these things evolve with the increase in AI note services.
Well, are there any benefits to a longer note, just for the sake of exploring?
There is this interesting, when you go to be a mental health clinician, you're very dedicated to your patients. And I've encountered dozens of clinicians over the years that felt like, if I'm not writing a longer note, then I'm somehow not doing a good job with my patient, or I'm not being thoughtful enough about the therapy process. So there's like this extra guilt piece that, well, if I don't write a certain amount, then I'm not a good therapist, which is totally not accurate, of course, but this is a feeling that people have, where we care a lot about our patients. They're telling us everything and lots of details and private information about their life, and it's our job to take that in and help guide them and help them get better. And so the idea of, an intense 50-minute session where someone's talking about childhood trauma, the idea that you're putting 3 bullet points for all this personal sharing and data of your patient, doesn't feel right in that context. And I'm saying that I understand this feeling, and I know lots of clinicians that, intentionally write more, because even though no one will ever see the note, or, it's unlikely people are going to be going back and looking at it, it just feels like that's what they're supposed to be doing for this therapy process with their patients. So maybe that, the AI or having something else, adding more information, can help people feel better that they've documented enough about the session, and that can be a positive. But
yeah, no, interesting. Cool, because I was, as you were describing that, I was thinking about how, therapists are empathetic people, and they want to be as helpful as possible, and they, it makes sense that they would want to feel like they're doing everything that they can to help the patient. And I think it's a very common human behavior for us to place higher value on something, knowing that, time is the most precious resource, and if time was devoted into something, then that means it is of higher value. So I was thinking about that as you were describing it. I'm like, oh, okay, it must be like, if they feel like they devoted the time to writing the note, then it feels like they did enough. But then I quickly remembered, well, wait a minute, we're talking about an AI note being written that is longer and actually is going to be using less time. So I guess from that framework in which I'm thinking about it, I wonder if that will actually still continue to be an issue, even if the note is longer and written by an AI.
Yeah, and I have found that what's happening with some clinicians is they are spending a lot of time reviewing those AI notes and really tweaking them. And so, yeah, is it going to be a time saver at all, or are they going to still have that pressure? Well, I need to spend this much time on the documentation. So whether I wrote the note or AI does, and I'm going to review it, it's going to be the same amount of time, and that will be interesting to explore.
Absolutely. Speaking from my own experience, if I ever use AI to help me write something, I find it to be the most efficient to write the thing first and then have the AI help you revise and edit. And then from there, you review over it again and make sure that it says exactly what you wanted to say and that your intentions are all still there. I think, hearing like, oh, the AI writes the note from scratch, that takes a lot of the initial work out, and I think maybe takes some of the intention out. I can't fully speak to how that process looks exactly for a clinician, but I guess that's just my own kind of personal tip. If you're ever going to be using AI to write something, is just make it as clear as possible what you want to say first, that way hopefully you're spending less time and having to correct it less.
Very good. Yeah, that sounds like the right way to do it.
All right. Well, let's go ahead and talk about the mental health business moment for this week. What are we looking at?
Yeah, so this is what's on my mind is that our clinic with our 3 psychiatrists is essentially full now, where schedules are filled, and we want to maintain not taking too many patients so that we have the right amount of space for follow-ups. And there is a cycle of patients getting better, and so there will of course be more openings, but this is the case when you start a practice, that it's slow at first, and really we came on more full force January, February, and we're 8 or 9 months in, and the clinic has been filled, and the idea is to bring on more providers to keep providing more care, but that's not happening for several more months. So now we're back in this unpleasant situation where we have to kind of post that we don't have openings. People can sort of continue to complete the form for interest, but that we are, there's again no availability here. And in the perfect world, you would have sort of predicted this timing a few months ago, and then worked on getting more staff available so that there's not this loss of ability to serve people who need mental health services, both business-wise, right? Because if we're now turning away clients that we could be serving, that could create more revenue for the company, in addition to hiring the more staff and providing more employment opportunities. But I think from this care perspective is the hardest part, that especially for groups that take insurance, if you become filled, it is hard for people to find other care. So yeah, that's definitely been on my mind.
Yeah, I mean, that's a great real world example, I think, of something that we talked about in one of the first episodes of the podcast. I want to say it was our second episode of the podcast, where we were talking about kind of like financial implications. And this is very top of mind because we were editing Ripsy Bits recently, and this was one of the clips that I think we've already released. I think it was Ripsy Bits episode 1 or 2. If anybody's not familiar with Ripsy Bits, it's kind of just clips from the podcast of Tom giving really great answers to my questions. But in that episode, you kind of mentioned a surprise cost that you didn't foresee when you first started was, you start a clinic and then you hire your first provider who's not you, and thinking like, oh, okay, I'm full right now. Now let me hire somebody. But then, things didn't necessarily just fill up, and you kind of felt bad that they didn't have as much work because the demand was not, meeting, how much availability you had. So I guess my follow-up question to this business moment is, so you being in that situation now, how does one strategize around that? At what point do you think you'd feel comfortable bringing another person on, and what would be your kind of playbook around that?
Yeah, I mean, I think taking what we've learned over the years, our plan is to bring people on very part-time on sort of a, you get paid when you see a patient type model. In general, I'm more of a fan of the let's get people regular employment with benefits, and I think that tends to make a more collaborative, right, happy workplace. But the financial risk to just hiring someone at a full salary with full benefits without having a guaranteed full schedule for them is too much of a financial risk. So I think the plan will be, and this is so many people who do private practice supplement their income by doing a few hours with one of the national telehealth groups. I think, we'll start by finding someone else who wants to do a few hours with us, that we see turning into a more part-time or full-time employee. And we already have some people who've reached out. So I think that, we'll see how it goes.
That sounds great. All right, cool. Did you want to do the outro for this week's episode? I can go ahead and tackle it if you're not prepared. Let me give it a shot here. But there you have it, episode 30, a monumental number. Thanks everyone for joining us on this week's episode of the Sit and Stay podcast, brought to you by RipsyTech. We'd like to remind people that if you have questions you'd like to submit, please go ahead and do that. Or if you want to be a guest on our show, send us an email at sitandstay@ripsytech.com. And all right, Parker, nice to see you, and I'll look forward to seeing you next week. Sounds great, Tom. Appreciate it as always. And see you next week.
Thank you for tuning in to this week's episode of the Sit and Stay podcast. Until we meet again, we invite you to sit and stay with the ideas and stories shared today. Dive deeper into how RipsyTech can support your practice by visiting us at RipsyTech.com.